Hi, Dr. Wright again from Walnut Creek Animal Hospital in Purcell, continuing our series on administering first aid to the working class canine. So those field trial dogs or any hunting breed, sporting breeds, even the canine working dogs, drug dogs, bite dogs, those sort of scenarios. So we've already covered field exams, or what we call a tailgate exam, which is a real brief exam looking at the normals, looking at the vitals for these dogs, what their vital signs are, and what the norms should be. We've also looked at, up to now, the two different types of kits that you should have in one for a field kit, all the items that you would need to take with you whenever you're working, so that you can deal with any trauma that might be experienced, at that point. And then also a more comprehensive camp or field kit, which we'll get to in other videos. So we're to the field kit right now. So the first thing we want to look at is some type of carrying device. And so the reason I like these are actually individual first aid kits, IFAC kits that you can buy online. The whole thing together, whenever you buy these kits, we're somewhere in the $20, $25 range. You can spend as much as $150 on some of this stuff, but kind of what I wanted to do more so is specifically give you what I feel like you need in this type of kit. And each item may vary a little depending on your skill set and what your abilities are, in order to handle as far as trauma. But from a basic standpoint, these are kind of the items. So first of all, we want a good carrying kit that has multiple types of restraint types of devices inside of them. This one I like the most out of all of them I've seen. They have zipper pockets, etc. Also has MOLLE strapping and a small handle, so you can fasten this to your belt, or you can put this on a backpack or a camelback or something like that. It's pretty easy to get in and out of the field in tight places, that sort of thing with, and you still have a trauma kit. So basically that is what this kit involves. It is for the catastrophic event that has happened. This dog, has been tracking, crossed the road and was hit by a car. Has encountered, an animal in which we've been tracking, and now that animal wasn't dead once we got to it, and so it wound up in an altercation and ended up severely injured, or even on the law enforcement side of the scenario. So search and rescue, we have a dog that has possibly fell off of some type of structure into some area and injured itself, or also working dogs, bite dogs, the dog's been stabbed or been shot or something like that, has a gunshot wound. So we're looking at major trauma, things that we got to really put an immediate fire out to try to prolong this dog's life so we can get it back to an area in which we have greater resources for care. So ultimately the basic is we kind of start looking at hemorrhage control, and so in a kit like this, the things that I want, first and foremost, are going to be in bandaging material. I want some sort of clot promoting gauze or wrap, or they make these in packings, powders, you name it. I mean, there's a lot of them out on the market. There's a few that are veterinary products. There are numerous that are human products, all of which work similarly, but they help to provide hemostasis underneath the bandage. And so then we move on to bandaging type material. So there's lots of things that can be used, and if you don't want to buy a commercial kit, you want to put your own together, you can think of things like feminine hygiene products work really wonderfully at producing a packing sort of wound area, and gauze, obviously various types of conform wrap and stretchy gauze to hold all this stuff either on a chest cavity or onto a limb. The other thing that's really, really nice is Coban or vet wrap. A lot of these kits come with this, and it's a very self-adhesive sort of wrap. So once you get an area packed that's bleeding or hemorrhaging, you can apply this, and it does two things. One, it applies direct pressure, but it also sticks to itself, and so it's a pretty effective tool. Would not go without this. The next thing probably that's equally as important but has limited use in a canine is some type of tourniquet. Most of the human IFAC kits come with a commercial tourniquet, and they're all intended for use mainly in dogs, and there is some in people, but there is some application in dogs, you know, with all of these products. The one I kind of like the best is the rat's tourniquet that's made, and seems pretty simple to use, and it's big enough that you can get it around a lot of different areas. Also can double as a leash if you need it. Which brings me to, you know, you need some sort of leash, some sort of containment apparatus. Most people will have their dog on a harness or something like that. But the second thing that this small type of D-ring leash does is it doubles as a muzzle. And so whenever we're working with this dog that's been injured, we want to make a muzzle, and we'll have a how-to video on how to make a muzzle out of various items. But this is a pretty effective tool, you know, at creating a muzzle immediately to close that dog's mouth so it doesn't bite you, so we can render the first aid that needs to be done. Secondly, probably as far as instruments are concerned, I like to just three basic things. We want to have a good pair of shears, which a lot of these kits come with a good pair of shears. I always like to have a pair of hemostats. If I've got something that's bleeding really, really well or pretty severely, you know, you can reach inside of a wound, get a hold of it, you know, and you can actually bandage this up inside there if you need to. So the other thing is retrieving, you know, items maybe in an airway. You need something that really gets down into a small, tight space. So a good pair of hemostats. Same way with reaching into areas or pinching things off, a pair of thumb forceps. Most of these, I threw this in there as far as a tourniquet is concerned because it's what we use in hospital a lot of the times, but it's basically a blood draw or a phlebotomy tourniquet, but it's a rubber piece of elastic, and so there's a lot of uses for this in the field. You know, if we need to tie something down, you know, it'll double for that, but also would work as a tourniquet. So anyways, we just keep that around. The next thing is a Sharpie. There's a lot of times we overlook things like this. For instance, whenever we apply one of these tourniquets, a lot of these things will have a space in which you can write when the tourniquet was applied, when it was released last. These are important pieces of information, especially if you're out in the field and you're quite a ways away from either your camp or, you know, help, veterinary help, medical assistance. You know, we need to know these things. The other thing that you might encounter that we would really need to know is the dog became snake bit. Man, what time did that happen? And give me an idea of what you thought it was. A cell phone's a great thing to carry too, because you can take a picture of it, you know, if it's still around, that sort of scenario. So anyways, Sharpie needs to be included. Most of these kits will come with various types of preparation of antiseptics, wipes. These two are povidone iodine, which is more of a cleaning, scrubbing sort of prep, and then alcohol pads. So, you know, in the field, we're not necessarily worried so much about sterility, but if you need to clean something up, these are pretty friendly to be able to do that with, you know. The next thing is most of the human IFAC kits come with a nasal airway. And these are really not very applicable to the dog because the distance between the tip of the nose and the oral nasal pharynx is most of the time longer than what these things are. But they do work great, and I like to keep one in there for multiple reasons. One, my kit serves as a people kit and a dog kit, so in case somebody at my own party or myself become injured, I have what I need to be able to take care of it. But you can also do emergency tracheostomies. If you have a dog that's choking, can't get any air through the airway, here's your perfect little tube, you know, to be able to insert into the trachea. So those are the reasons I keep those sort of things around. But you can supplement this with a piece of rubber tubing or hose, something that's non-collapsible. The next thing is moving towards wounds like entry-exit wounds over the chest. Or abdomen. These are actually, they're called high fin vent chest sealant packs, and so they're made for, you know, entry exit wounds in the chest. So it basically seals the chest off. It's a little bit limited in the dog in that the hair is a little prohibitive at allowing a full seal, but if you can make the hole close, it decreases the amount of air that ends up in the chest, you know, and this type of thing. So I like to keep them around. Once again, 2 reasons, humans and dogs. Treating shock, those sort of scenarios, there's nothing better than these little Mylar blankets. They're very, very compact. They'll fit in tight spots. Unfold, most of them are, you know, around 60 by 60 inches, and so you definitely need one of those. Nice to have a good pair, several pairs of rubber gloves just to, you know, keep your hands from being real contaminated. The other thing that really we have more in dogs, it's a little bit of an issue with certain dogs that work really, really hard and have fair body condition. They become hypoglycemic. So to treat hypoglycemia in the field with these dogs, I always say go to your salad bar somewhere at your local restaurant, find you some honey packets, and put a couple of those in your kit. It's a great oral source, rapidly absorbed sugar for those dogs to be able to administer in the field. And then plus or minus, you know, some sort of container of water, Camelback, bottle of water, serves purpose for yourself or somebody else if you need to flush an eye, you know, or the dog actually just needs a drink, he's gotten too hot, you know, that sort of scenario. So this is kind of the basic contents of what I think should be in a field kit. And like I said, the majority of this is your responsibility to be able to build a kit for you that, one, you know where it is, what is in it, and how to use everything that's in there. And so it pretty much so can be molded once again to your own capabilities. So the next video will be on the truck kit, so it'll be a little more expansive.